Time now 12:12. Thanks for staying with us this afternoon. From expiring mask requirements at Milwaukee Public Schools to a new breath test for COVID-19, we are following several new developments this afternoon on the coronavirus pandemic. So I want to bring in the expert here. Let's bring in Dr. Jeff Pothof with UW Health to sort it all out. Dr. Jeff, thank you for being with me on my second day on air. It's good to meet you virtually. Of course, this is big news coming down. A federal judge in Florida recently struck down the Biden administration's mask mandate for airplanes and other forms of public transit. So, coming from the expert here, do you still recommend that people wear a mask on public transportation?
Yeah, I think, for right now, there is some insurance for us if we do wear masks on public transportation. I liken this to, a controlled burn. By taking those masks off, we're adding a little bit of fire to the grass, but we don't have the weather forecast yet. If the wind doesn't blow, we're all going to be okay. But if the wind blows, we could be in a little bit of trouble. And really what that gets to is if we have an increase in cases that leads to hospitalization, we may regret that we pulled back these mitigation efforts. If we have an increase in cases and no hospitalizations, then this would be an okay call.
Okay, so for someone who may have or who may know someone who is immunocompromised and may live with that person, if I have to hop on a plane, what can I do to stay safe if some other people are not wearing masks?
Absolutely. So we do have a lot of people in our communities who are high risk for COVID-19, whether immunocompromised or their immune system just doesn't make a response to the vaccine. The best thing they can do is to wear a mask on that plane, knowing, though, that, masking works when both parties, the person who has COVID and the person who does not have COVID, are masked. So even if that person does mask, if other folks on that aircraft have COVID, it's still possible that they could then catch it.
Okay, well, Dr. Jeff, let's move on to Milwaukee Public Schools. This is a big one as well. No longer requiring masks now. This comes as new cases are ticking up. So how could this impact cases overall, you think?
Yeah, I think, unmasked schools, we could see cases increase. And it really is whether or not we see increased hospitalizations. So, in our schools, we have the ability for those kids to be vaccinated. Many of them are. Many of them have recently had COVID from our last Omicron surge. If that holds true and they have good immunity, we could remove the masks and we might see some additional cases, but those cases should be mild. If we remove masks from schools and we start to see an increase in hospitalizations, that threaten the ability of people to get their healthcare needs met, that's when we'd have to reevaluate some of these decisions to remove these mitigation strategies so that anyone who needs healthcare resources can get them.
Yeah, certainly information parents could use. Dr. Jeff, I also want to touch on the new FDA breath test for COVID. This is a new information coming down here. So how does it work, if you could explain it, and where exactly will it be used? Because it's very similar to a breathalyzer, right?
It's similar in how it works for the person using it, but the technology is a little bit different. It basically, people with infectious diseases, when they breathe out, they may have a specific makeup of what's called volatile organic compounds. And if you can figure out what that rate of volatile organic compounds are in someone who has COVID, you can do this test that separates out those compounds, tells you how much is there, and you can say with some degree of certainty, yep, this person has COVID, or maybe they don't. And this current breath test that they have performs about the same level as an antigen test, so not too bad. I think it has a lot of cool factor. I don't think it'll likely replace these antigen tests. One, it's a fair bit more expensive to have that device, and it needs to be administered in a clinic or someplace where someone is trained to administer it. Say versus these antigen tests now, they're widely available. People have them in their homes, and they're fairly affordable. So I think it's cool technology, but I think the antigen tests will probably win out at the end of the day.
New test, new information. Dr. Jeff, we appreciate your time this afternoon. Information from the expert there. Thanks for your time. All right, a reminder, you can find the latest information on the coronavirus pandemic, including information about where to get tested or even where to get vaccinated at tmj4.com/coronavirus.